Welcome out there in television land to the fastest 30 minutes in television history. Philip Benyo with Philip Benyo, also known as the Fipster. We're here to bring you the latest and the greatest in health news information. Please check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. Right, Fipster?
That's right.
We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Be right back. Welcome back to the first segment of It's Your Health. I'm here with the Fipster, and the holidays are upon us, Phil, and maybe you could tell us a little bit about, is it Holiday Heart?
Let's start with the headlines. Here, you're giving the previews before we're even starting. Heavy drinking may strain heart. People who abuse alcohol are 70% more likely to have heart problems, such as heart failure.
And we typically see this after New Year's Eve. People go into atrial fibrillation and have maybe congestive heart failure, directly related to the toxic effects, if you will, of alcohol on the myocardium.
Yeah, it's not that even, what's neat about the studies is it actually showed it in much younger populations, that it wasn't something that's restricted to people who already have heart disease. So people who are in their 20s or 30s who think they can get away with heavy drinking, it is going to have a strain on their heart muscle.
Holiday Heart.
One energy drink boosts youth's stress hormone. Just one Rockstar energy drink increases your norepinephrine by 74%.
Now, these are these energy drinks that are currently in vogue, and they're just like chock full of adrenaline, I take it.
It's caffeine, there's taurine, guarana, ginseng, there's a lot of stimulants in there, and it really boosts your norepinephrine. We've had a number of patients who are young, in their 20s, blood pressure's high, their pulse is high, they're anxious, and you talk to them, well, I drink 5 Rockstars a day. Well, I need energy. I'm like, that's part of the problem.
Yeah, I think you ought to get back to Ovaltine as your energy drink, or Bosco when we were growing up.
I don't know what that is. Let's move on. Myth of the month, and this is a real myth for me because I've been guilty of this. Metronidazole and alcohol.
Flagyl and alcohol is a no-no, correct?
Well, I thought it was a no-no because it had what we call a disulfiram reaction, meaning that when you mix alcohol with metronidazole, it produces a lot of chemicals that really will make you super sick, and in some cases you can vomit, die. But it turns out that's not true.
So you can safely take your Flagyl and have your beer, I guess.
Snifter of port, as it were.
There you go.
Well, we're getting in the flu season, and there's a lot of talk now, the low dose versus the high dose vaccine. This was something we had last year, but it's certainly much more prevalent this year. What are your thoughts on that?
Well, they mirror what's currently recommended. If you're over 65, you should get the high dose flu vaccine. And for those that are younger and perhaps don't have as many healthcare issues, you can get away with the good old-fashioned flu shot.
Absolutely. Now, we do this every year, but I think it's really important. Let's talk about the symptoms of the flu versus the cold, because I've had a number of patients already say to me, we're here in the middle of November, and they say, well, I've already had the flu twice this year. I don't think so.
No.
The flu is really not out yet. It really doesn't come until December, January, February. But let's talk about the real key differences. And if you look up on the screen, you can see, some of the main things. I think some of the big things are such as a headache. There's a headache, you're going to have a real probability high headache.
Right. You're going to have flu-like illness.
How about you have high fever?
Generally flu-like.
How about you're sniffling and sneezing?
That sounds like a cold.
Right. How about severe muscle aches and pains?
The hit by a Mack truck. It has to be a Mack truck.
Yeah.
That's the flu.
And it's that quick.
Yes.
You don't say, I think I've been getting the flu for 2 or 3 days. You'll wake up in the morning feeling great, and by 4 o'clock, you're done.
Exactly.
Okay.
And and one Thursday night, I was leaving the office, true story, and I came down with these headache, high fever, hit like a truck, and I knew I was getting the flu. And fortunately at home, I had what you should have, and that was Tamiflu in my medicine cabinet. And I took the Tamiflu, and believe it or not, the next day I came to work. I mean, you really should have that on hand at the first onset of not the cold, but flu symptoms. I'm telling you, it will abort it.
Yeah, absolutely. Now let's also talk about why we should get the flu vaccine. Certainly you don't want to feel like this, but a lot of people say, well, I get the flu, I don't get the flu, it really doesn't matter. But there's some other long-term consequences that are pretty scary with getting the flu vaccine and preventing the flu. And one is actually, they did a study to show that people who got the flu vaccine to help prevent the flu had less of a chance of having a heart attack.
Yep.
Now how are those two going to be linked?
Well, that's a good question. I think if you're someone who gets that ill, you can bump your cardiac enzymes. We see it all the time. People come in the hospital with a septic process and they give themselves a stress test, bump their cardiac enzymes, maybe have a cardiac arrhythmia, skipped heartbeats. If you go into the Slovak cemetery and look around 1918, you're going to see a zillion tombstones. Why? Because that was the flu epidemic. That took out a lot of people in our area. It was worldwide, millions died. People can die from the flu.
Absolutely, and you don't realize that even younger people can end up having a lot of heart problems. So it's important to certainly get the flu shot. And if anything, you get the flu shot so you can prevent spreading it to the next person.
That's a big deal too, and that's why the flu tends to aggregate after Thanksgiving and Christmas, because we go from playing football outside to seeing basketball games inside. Family members get together, and it's just start of a wash of this flu-like virus amongst us.
All righty, let's move to a little bit more upbeat topic.
Okay.
Let's talk about arthritis in the knees. Typically common thought is, when people have a lot of advanced arthritis in their knees, or even the start of arthritis, the first thing they're going to say is, I got to stop using it. I don't want to hurt my knee. I have arthritis. So I'm going to sit and do nothing. I'm going to sit around and do nothing. What do you think?
Well, they're very counterproductive, and it's kind of no pain, no gain, if you will. There is no question that in order to combat osteoarthritis of the knee, which is an age-related thing, a weight-related thing, exercise has been shown time and time again, physical therapy time and time again, to help with the symptoms of osteoarthritis. Now, we want to stay away from the anti-inflammatories. They cause hypertension, they can cause issues with ulcers, kidney disease. Sometimes we do joint injections. They can be very useful. Ultimately, you might need a knee replacement, but beyond that, exercise, correct, Phil?
Absolutely. I think exercise, doing it early and often, is very helpful because it's going to help strengthen the muscles around that knee and strengthen the tendons and allow better stability, because what gets people in trouble is when that knee joint starts to have some stability issues, and that's when you start roasting off pieces of the meniscus, and that's when you're going to start getting a lot quicker down the line to needing, injections, knee replacements, and having a lot of debility. Exercise early and often.
Right, and weight loss, you would not believe the forces that are subjected to the knee going up and down steps and the like. Well, I told you it's the fastest half hour. This is the fastest first break we've had here on It's Your Health. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Welcome back to the second segment of It's Your Health. Philip Benyo with Philip Benyo, bringing you the latest and greatest cutting edge of healthcare information.
Alrighty, let's move. Headlines: diabetes in seniors may increase dementia risk.
It's sort of an interesting story, and if you think about it, diabetes is a systemic disease that affects the eyes, the heart. You can get blood vessel issues, kidney issues, neuropathy. So why not the brain? And so by cutting down on circulation to the smaller blood vessels, it can affect those key areas that can affect personality. You can have cognitive memory issues. And unfortunately, once these things start, there is no pill for that. I think it goes back to controlling your diabetes and your risk factors, hypertension, hyperlipidemia, and the like. Is that pretty much it?
That segues into the next thing. The SPRINT trial shows that systolic blood pressure, a target of 120, saves lives. Now, what's kind of the old way, and what's now the new way? And now there's some even newer information.
Like eating meat on Friday, they change. Old way was the first number had to be 100 plus year age. Of course, that went by the books. And lower is better to a point. And we're talking more about the younger folks, because in our line of work, beyond 65 and 70, sometimes too low may lead to fall risks and be very counterproductive. You might need a little more head of steam, so that the systolic, the first number of 120, may not necessarily be appropriate for someone who's elderly because they have issues. But for the younger crowd, no doubt.
Yeah, absolutely. It showed that, they were able to show if we kept the target at 140, X amount of people we helped, save lives. But if we actually lowered that to 120, especially in the younger populations, it was so profound in the study, they actually stopped the study early to sit and write the paper and talk about it. And we've been talking about this before. But I agree, certainly in the elderly population, if you look at all-cause mortality, 80-year-olds don't die from high blood pressure. They die from falls and associated things. And so a lot of those falls are actually related to over-treating their high blood pressure.
There's no doubt. And just like a car tire, if it's overinflated, your blood vessels are going to wear out prematurely and rupture. And hypertension is probably the number one underdiagnosed and undertreated disease we see.
Let's talk about that a little bit more and talk about primary aldosteronism.
Oh, that's a big term. But it's very common. As I mentioned, hypertension is underdiagnosed and undertreated, but it's also not recognized, and it's silent, which is the killer of it all. You're trying to find a disease in which you have no symptoms. People will certainly try to seek treatment for pain and symptoms, but when it has no symptoms, that's the tricky part. And if you're out there with hypertension, it could be 2 out of 10 of you may have what's called primary aldosteronism, which we will learn about now.
Well, this is, when we always talk about high blood pressure, I usually tell people, the first, second, and third cause of high blood pressure are family history. There isn't really necessarily anything else. It's diet makes it worse, but it's mostly genetics. Primary aldosteronism is a little bit different, and what it is you have in your adrenal glands, you secrete hormones that regulate your blood pressure, and for some people, they secrete way too many of these hormones. And usually I'm very guilty of this. I just treat blood pressure until we get it down, but I don't think of this very often. If I have a patient who has on 3 or more blood pressure medications and I still can't get them under control, I need to think about this. If I have someone who's hypertensive, they're on a couple of meds, and their potassium levels are low, that's a real flag that says this person has something else going on. The tests are a little bit tricky, but not horrible. Usually we do some fasting blood samples to look for some hormones that may be elevated. And actually we get to put people on a high salt diet for 3 days. Really high salt diet. I never say that, but we put people on a high salt diet for 3 days. We repeat these tests in urine tests, and we can see whether or not these hormones have changed. And depending on how those are changed and how we interpret them, you may have primary aldosteronism. It's treated very differently. Sometimes we have to use specific medications to help lower their blood pressure. Sometimes these people, we have to look and see if they have a small tumor in their adrenal gland that we need to actually have cut out.
Right.
And so you say 2 out of 10. I think the numbers are close to that, and it's something that we need to think about more.
It's closer to 1 in 5, isn't that right? 2 out of 10, 1 in 5. Think about it.
This is making my jaw hurt. So on that note, let's talk about TMJ or TMD,
very good.
Temporomandibular
Yes.
dysfunction.
Certainly going around out there. We see a fair amount of this, and the temporomandibular joint is a ball and socket joint in your jaw. It can cause pain, and sometimes it's due to malocclusion, where your teeth are perhaps not in alignment, and it's kind of like a tire being out of alignment. I like the automotive.
You're on that vein.
Automotive examples here, but tell us a little bit more about it, Phil.
Well, pain, difficulty chewing. A lot of these people have a lot of jaw clenching at night. There's some things you can do at home that I think are very simple, because this is a hard condition to treat. It doesn't respond really well to injections. Very rarely people get their jaw replaced, which is a brutal operation. But if you look at this screen, there's a couple of things you can do. Again, it's all about tension in your jaw. So set a timer on your phone or watch every hour. Set a timer that goes off that reminds you, am I clenching? And if I am, let's relax. Try to eat softer foods. Taking big bites of hoagies on one side, bad idea. When you have food asymmetrically loaded, it causes an asymmetric load on those muscles, and it causes a lot of rocking of that jaw. That's bad. Find a physical therapist. Physical therapy can go a long way. They can do ultrasound, some electric stim. These things can help reduce that tension. Thirdly, run hot or cold. If you feel it's hot, and you feel the muscles are tight, put a hot compress on it. If it's just sore, but you don't feel a lot of tight muscles, put a cold compress on it. You can play with that. And lastly, consider a night guard, because it all falls down to that clenching at night, or that grinding of your teeth, or bruxism as they call it. Sometimes seeing a dentist to get fitted for a night guard can really make a difference.
Don't tell my wife, but she has this, and I think it's from excessive talking, so I've told her to kind of dial it down, and maybe it'll go away. Along with
That wasn't on the list.
other things that's on the list.
Alrighty, lastly, this is a really neat picture. You know, seasons change. We see a little bit more upticks of shingles. But if you look at this picture, what do you see?
I see shingles in various areas, and if there's one reason to get the shingles vaccination, this is one of them. Can you imagine this on your face?
Oh, this would be terrible. This actually is a gentleman who's been on prednisone for years, and in immunocompromised individuals, that's someone who really should think about, you know, the shingles vaccine. But this is something that's very rare. I usually tell people we never see shingles in different parts of the body, but in someone who's immunocompromised, they can actually get a shingles outbreak in a couple of different parts of the body. And so this is very consistent with that. It's very rare. I think I may have saw a case of shingles bilaterally once. I was too young to really come out in a claim and say that's what I saw. I couldn't believe that. Since then, I've never seen it.
But you've seen us here on It's Your Health. We're going to finish out the second segment. Be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Welcome back. I can't believe it, the final segment of It's Your Health. We're just going through a font of medical information here, correct?
It's the high definition that makes things faster. Right. I really think that's what it is. You're going to see this, and it's going to be one of those, like, do you know in 2001 Space Odyssey, that scene at the end when the lights are going fast? That's how this show is.
Exactly. You'll have a seizure watching us.
Okay. Another headline. This is a neat one, but again, this kind of talks about things we knew years ago back in the coal miner days, and now we know now. Risk of rheumatologic disease is associated with occupational exposure in male construction workers.
Isn't that interesting? And it has to do with silica, which of course is not new to us because the first series of breast implants were silicone, and they kind of created a whole bunch of autoimmune disorders. So naturally, if you breathe in silica, which is kind of like a dust out there in construction land, that can set off autoimmune disorders. An autoimmune disorder means that your body thinks you're the enemy and starts attacking it. Pretty much accurate.
And it also goes, actually, you can go back a lot further to the coal mining days when they first started using pneumatic drills as opposed to the old hand pick. Pneumatic drills created so much dust. That's when we first started seeing like siliconiosis, you know, the lung conditions and all kinds of other offshoots of that. And so certainly if you're in the construction world and you're working around dust, you got to really take it seriously about wearing some masks or some ventilators and look into it, because a little bit of dust every day goes a long way. And once you kind of have these disease states, they're tough to treat.
And yeah, once the dust is in, you're not gonna get it out.
Vitamin D promotes heart health.
Well, we've been big cheerleaders for vitamin D. I'm willing to bet most of you are vitamin D deficient. And I have yet to do a blood test on a new patient who is not on vitamin D and have a normal level. That's just the way it is, especially in these northern climates. But vitamin D is a tremendous supplement that we should be on, and maybe it can tell us a little bit more.
Well, I think it's absolutely, you're right. That's the big epidemic. Certainly we've cut down on skin cancer rates by using SPF and watching the sun, but we've created a vitamin D epidemic. There's always give and take. The neat part about this study is from a heart health standpoint, it shows we don't necessarily have to get vitamin D levels quite as high as we're pushing them. We like to see it above 32, but this study showed that, if we get the level above 15 from a heart standpoint, we're doing better. Now, it didn't make any comments about a joint standpoint or muscle standpoint, which certainly vitamin D plays a very big role in as well.
Yeah, it comes as a supplement. Some people who don't like the supplements and are pretty deficient, we give like 50,000 units a couple times a month to get you up there.
It does the job. All righty, let's play a game.
Always, let's do it.
All right, we're going to play myth versus fact.
All right. Am I the myth or the fact?
Huh? You're the fact.
Okay, so am I going to ask you a question?
You're going to
okay.
read.
Here's a myth, Phil. A normal heart rate is 60 to 100 beats per minute.
Well, that used to be fact, but it turns out that's a myth. Really? The actual average heart rate, we would actually see more between 50 and 70 to 80 beats a minute. And having a resting heart rate in the 80s, although means you might be okay, it does not necessarily mean you're healthy. And so for healthy individuals, we actually want to see that heart rate just a little bit lower.
Lower is better. Okay, second myth versus fact. An erratic or skipped heartbeat means I'm having a heart attack.
Well, I'm going to say myth. And because it does not mean you're having a heart attack. There's a lot of different things you could be having. You could be having skipped heartbeats are what we call palpitations. And there's a lot of different things that can cause that. And if you look at this list, what could cause your heart to skip or palpitate is alcohol, caffeine intake, exercise and stress, thyroid disorders. It doesn't mean you're not having a heart problem. It doesn't necessarily mean you're having a heart attack. But if it's something new or different for you, definitely get it checked out.
Yeah, absolutely. The heart, of course, is divided into different chambers. When you have skipped heartbeats on the top of the heart, they're generally not as bad or as life-threatening as ones on the bottom, and we need to figure out which ones you're skipping. Okay, another myth. So far, you're batting 1,000. If my pulse is too fast, I'm stressed out.
That's a myth.
Okay.
If your pulse is too fast, there could be a variety of things going on. A stress will elevate your pulse very temporarily, but it does not necessarily, that is a very short-term thing lasting a few minutes. Your pulse isn't going to sit at 100 beats per minute all day because you're stressed out.
All righty. Moving right along. If my heart rate is normal, my blood pressure is normal. Is that myth or fact?
That's a myth.
Okay.
That's something we hear a lot. In fact, sometimes blood pressure and pulse has a reciprocal relationship, especially for people who have high blood pressure. Their pulse will be just fine down in the 60s and they will feel great. And remember, we talked about earlier, blood pressure is an asymptomatic disease.
Right.
If you should get it checked out.
And conversely, if your heart is slow, does that mean your heart is weak?
That's a myth.
That's a myth. Another myth.
Well, we know athletes, Lance Armstrong, despite his digressions, a great athlete, has a resting heart rate in the 30s or 40s.
Right. Yeah.
A well-tuned heart will be able to produce a ton of power. This is your automotive stuff.
There we
You'll
go.
be able to produce a ton of power at a low RPM. And so actually a lower heart rate, as long as we're not having any dizziness or lightheadedness or we're passing out, is a really good sign.
Good sign. All right. Very good.
That was fun.
Moving right along.
All righty. It's wear and tear year. People are at the end of the summer and we're in the middle of the fall. A lot of pain, arthritis. Let's talk about what we can do kind of in the office and what's a good idea when we want to shoot things up and when we want to inject versus a bad idea.
Right. Well, I hate giving a pill that goes from head to toe and can cause side effects when the problem is localized in a joint that we can inject, right? And there are some conditions in which joint injections are terrific.
Absolutely. And this study, they looked at a bunch of different studies for all these different conditions, and they gave us the strength of evidence to say, is this a good thing to shoot up or is this a bad thing to shoot up? And so adhesive capsulitis, okay, this is adhesions in the shoulder joint. This is something we can shoot up. Yep. Okay. How about carpal tunnel syndrome? What do you think?
I'm not a fan of shooting that up, but I guess it can be done.
The evidence actually shows if you catch it early, injection by a hand specialist and orthopedic specialist certainly can help decrease your risk of heading to surgery and really lessen your symptoms. Let's talk about other things that may not work out real well. And this is a common one we run into is I get people come in and say, oh, I have pain here, I have pain here. They have lateral epicondylitis or tennis elbow, or they have medial epicondylitis, which is golfer's elbow. How about shooting these things up?
Do they have insurance? No, we don't.
Doesn't matter anymore.
Doesn't shoot them up. All right.
No, we don't shoot those up. And the thing is the problem is the shot will make the pain feel great, but it will not help the core defect. And the person will go out and re-injure it and end up having more problems. This is something we definitely shouldn't be shooting up. Physical therapy is a much better option. Maybe seeing a chiropractor who does active release, I think that's the way to go. Let's talk about trigger fingers.
Trigger fingers sometimes, yes.
Absolutely. The strength of evidence shows with trigger fingers you can stave off surgery for quite some time and really improve things. How about wrist and hand arthritis?
I have to think about that.
That's a no.
That's a no.
All right. Well, you can see on the list there's a couple other things such as Morton's neuroma. There's really no evidence that it shows that helps. Knee arthritis certainly can help. Hip arthritis, these are tough because you really can't guarantee you're in the hip, without doing fluoroscopy. It sometimes helps, but there's better ways to treat it as well.
Well, we're getting the white flag being raised to us that we've again gone through another quick and fastest half hour in television history. Thank you for joining us. Hope we entertained and informed you on It's Your Health. Remember, we're your leader in healthcare information. Enjoy the holidays, and thanks for listening.